about 10-15% of people just sitting in hospital beds with nowhere to go. And I thought, in what world does this make sense that people are waiting in the highest cost place to go to a place, generally a nursing home, that they don't really want to go to, which actually costs the payer, in our case in Ontario, the government, quite a bit of money. Like, what world does this make sense, right? And then I started peeling back more and more layers and recognized that the problem is really universal across North America, but even globally as well. And obviously, we know the aging population. And I think I didn't notice it as much in the US because we have so many SNFs that we can discharge uh, patients to in the hospitals. And we're kind of just kicking the problem down the road, right? Like um, there are people stuck in hospitals in the US, no doubt, even back then. And it's only worsening now. A lot of SNFs aren't even accepting patients. But half the problem is also in the SNFs and getting people out to a community-based centers. My first internal med rotation in Chicago, I was at the VA. I remember my first patient, he was like, I'd rather die than go to a nursing home. And, that was my first patient. I'm in nursing home. I'm a medical student. So I'm spending like half an hour just trying to convince them. Obviously, nowadays, I probably wouldn't spend 30 minutes doing that. But, some of those memories really stick with you, and you realize there's got to be a better experience for older adults to have in their life. And we had about, 10, 15%